Trump won the 2024 general election in the US. What does that mean for healthcare, particularly for Black women? In today's video, we will explore a few questions that I have to ask the Trump and his administration as they assume office in 2025. Hi, my name is Suzanne Robinson Davis, and I am with Health Improvement Visionaries. And on this channel, we seek to improve the lives of minority populations. We want better health outcome for our communities. So we know that Black women face systemic racism in healthcare, often leading to dismissive treatment and poor health outcomes. We also know that addressing social determinants of health, such as housing, education, income, are vital to improving maternal and minority health outcomes. We also know that federal policies need to address implicit bias in the training of healthcare providers and also address structural changes to improve access to preventive care. So, I have a few questions that I would love to discuss with Donald Trump and his administration. They are now being selected or nominated for various positions in healthcare in the federal government. We know that Black women in the US are nearly 3 times more likely to die from pregnancy related causes than white women. So I want to know how the administration is going to prioritize the expanding of various services. We want to know about midwifery and doula care, which are used in many communities, rural and urban. We want to know how the administration intends to invest in culturally competent care. We also want to know about Medicaid, postpartum coverage, and whether that can move from 60 days to a full year. We also know that Trump has strong influence over states and their policy making arm. So, can we see a reverse in the abortion ban? We know that healthcare is not about any one individual's preference. It is about the good of the whole population. I remember my first miscarriage and the doctors advising for me to do a DNC procedure. I didn't know what it was. I didn't know what it meant as it relates to this abortion ban, something that can preserve their lives and protect their reproductive system. So I want to know what specific policies will your administration implement to address the alarming disparities in maternal mortality among Black women? Question number 2. How will you ensure that minority populations, especially Black communities, benefit equitably from federal healthcare funding? We know that a lot of funding have been poured into rural healthcare systems. But how are we measuring to ensure that minority communities are benefiting from these federal healthcare funds? This is very important in preserving the health and well being of our minority communities. Additionally, Mr. Trump, what are your strategy for increasing diversity in healthcare workforce and leadership? We know that healthcare diversity in workforce will help to better represent and serve Black and minority communities. Too often, we are told that there is just not enough persons of color, of culturally similar backgrounds that can provide treatment in healthcare. So, what will you do to address this? How are you going to ensure that all persons trained, regardless of their racial or cultural backgrounds, can provide competent care for all people? This is very important in maintaining a healthy economic environment. Also, Mr. Trump, what accountability systems will you put in place? How will you know that equitable healthcare delivery is being done and provided for minority populations, particularly Black women? Also, Mr. Trump, we know that you love to win. And if you put in these systems, you want to make sure, without a doubt, that they are working. So they need to be accountable. How are you going to make sure that these systems are accountable, that they're delivering care to minority populations, particularly Black women? We know that this is something that you value. So, despite all that is happening, we want to make sure that not only you, but your administration and also the people of the United States and around the world, because we're all concerned that the systems are able to be reported, whether through the insurance companies, providers, departments of health. But you have made sure that you have built a robust accountability system that is going to demonstrate that healthcare is being equitably provided for in minority populations, particularly women of color. Mr. Trump, we believe in the democratic process. And so I congratulate you on winning the election. You have worked hard. You have done what you needed to do, and you have come out on top. What is next is for people, the American people, the world, to see you as someone who cares about all racial groups, that the human centered approach to healthcare reform is emphasized through community driven solutions, that equity and accountability forms part of the healthcare agenda for those being nominated, that you will ensure that all people, including the minority communities, have special and dedicated measures. Healthcare in this time and in this moment needs you, Mr. Trump, to step up. You have held a big talk, and healthcare is one of the biggest problems that you can ever work on. It is a disaster. So we need your business acumen to come forth. We know a lot have been said, but it doesn't matter. What matters is that you take hold of healthcare. We need healthcare reform. We need a system that works for all people, particularly minority populations. We ask that your administration hold on to those core values and ensure that the work is being done and the work will be done so that minority populations can experience better healthcare outcomes under your administration. Thank you so much for joining today. And I hope that as we all look, we play a part actively in our community, in our advocacy, because healthcare requires not one and not two, but multifaceted approaches to solving this diverse giant of healthcare problems that we face. So as you go through your day, remember advocacy is important. Getting your voice out is important. Talking to your elected officials is important. So get talking, get doing, so that we can solve the healthcare problem not only in the US, but in Canada, in Jamaica, in every country that exists, there is a problem in healthcare. So we need your help. So get going. Have a good day.